guys, my name is Dr. Kristen and I work for Pelvic Prescription in Wilmington, North Carolina. What I wanted to talk to you guys about today is pain with sex. It's kind of a hot topic and it definitely affects men and women. So I think that's kind of something that people don't realize. So the reason for pain with sex is typically pelvic floor muscle tension, or that's one of the many things that can cause pain with intercourse. So for female anatomy, there are a lot of muscles that make up the pelvic floor, both external, so all of these muscles through here, but also internally. You see this bowl here? That is our pelvic floor. It creates a lot of support for our pelvic floor. It also helps with maintaining urinary continence. It also has something to do with our sexual function, but also our ability to go when we need to go and hold it when we don't want to. So not only do women have these muscles, but men have them as well. They do look a little bit different just because of actual anatomy, but you can see here that there are still so many different pelvic floor muscles. And then you look inside and those muscles are also in that pelvic floor bowl. There are some things that you can do to help treat pelvic floor tension if that is something that is happening for you with the pain with intercourse. There are several different tools. Something we offer in clinic to train on is the pelvic wand. This helps with pelvic floor muscle tension, especially some of those deeper layers. It can be used vaginally or rectally. So it's appropriate for both men and women. Something else that we talk about or can talk about is something called an O-nut. So what that helps with is pain with deeper penetration. That way people can still have enjoyable intercourse if they have that deeper pelvic floor tension. But this is a way for us to kind of work on that pelvic floor tension, but also allow you to still be intimate with your partner if that's what you guys are interested in. Another thing that we typically can use is something called dilators. Dilators are going to be more helpful for that superficial pelvic floor tension, so more of the opening. There are vaginal and rectal dilators depending on which gender we are working on. So that is my little spiel about pelvic floor and pain with intercourse. Let us know if you have any questions.